November is Prematurity Awareness Month, and Tennessee ranks among the worst states in the country when it comes to babies being born early. Well, the March of Dimes graded Tennessee a D- for its preterm birth rate. News 2's Haley Wilgus looks at what's behind the statistic and what can help.
I had just finished a class thinking I was going to have my whole birth plan laid out, and everything that I expected was not going to happen.
That birth plan went out the window when Dimeta Smith Knight found out she would be delivering her son 8 weeks early. She had some upper abdomen pain, which she thought was just heartburn.
Turns out I was suffering from a condition called HELLP syndrome, which is a severe case of preeclampsia. And the only way to save my life was for me to deliver. And so at 32 weeks, my son was born.
Austin was healthy but needed 3 weeks in the Ascension St. Thomas Midtown NICU to strengthen his lungs and feeding skills. Dimeta spent a week in the hospital as her doctors worked to stabilize her high blood pressure and extremely low platelet count.
There are a lot of risks for African American women in the hospital. So knowing that you need to have an advocate for you, we really got to focus on advocacy, awareness, affordability, and access.
Dimeta credits her medical team with saving her and her son's life, but she knows others aren't as fortunate. Tennessee ranks among the worst in the nation for maternal and infant mortality and preterm birth. The March of Dimes grades the state a D-. The 2023 preterm birth rate in Tennessee was 11.3%, higher than the national average of 10.4%. For Black women in Tennessee, the preterm birth rate was more than 18%.
A lot of areas in Tennessee that are very rural, and folks just do not have as much access to health care. Even here in Nashville, we can go blocks from this hospital and get into neighborhoods and areas where the rate of preterm birth and the overall health issues are just as high. We are seeing, increasing numbers of women who have hypertension, diabetes, and other problems that lead to preterm labor.
Dr. Kendall Graham is a neonatologist and clinical medical director of the St. Thomas Midtown NICU. He says reducing the preterm birth rate is an investment.
It always takes money, and that's one of those things that needs to go into public health and public health education. And I would say that probably really starts in our schools and at an early age about really reinforcing the importance of good nutrition, good health.
We definitely have to improve access to health care, affordability, and we really have to work on increasing the awareness of all the risk involved in pregnancy. Even though our journey in the beginning was a little rocky, everything since then has been amazing. He's hitting all of his milestones. He brings us such joy every day. So we are getting more than we prayed for.
Dimeta was nominated as a March of Dimes Champion of the Year as she continues to advocate for healthy moms and babies. In Nashville, Haley Wilgus, News 2.